Hi, I'm Dr. Brian Yeung, a naturopathic doctor here in Toronto. We will be presenting a series of videos related to different types of weight loss on this channel, so subscribe if you're interested in learning more. So let me get one thing straight here. No, I personally have never had a gastric balloon. However, I treat many patients who have undergone gastric balloon insertions. From all their experiences, I'm here today to shed some light into what you might expect if you get one yourself. What is a gastric balloon? It's a silicone balloon. They insert it into your stomach from your mouth and fill it with a colored liquid. They fill it with around 400 to 700 cc. That's about the size of a grapefruit, weighing 1 to 1.5 pounds, sitting in your stomach at all times. The procedure is quick, lasting around 30 minutes, and recovery is in 1 to 2 hours. It's so short primarily because nothing needs to be cut or opened up. It's technically not a surgery. It's simply an outpatient procedure. You'll be sedated and have the balloon crammed into your stomach from your mouth. I mean, carefully inserted into your stomach. The balloon is removed several months later, usually around 6 months, since it cannot stay in your body forever. So it's only a temporary weight loss solution. Side effects. I'm going to focus on the side effects after the surgery since I'm not an expert on the balloon insertion or the construction of the balloon itself, so listen carefully to your doctor that will be inserting yours. But generally, I would say it's pretty safe compared to other weight loss surgeries like lap bands or gastric bypass. Now, once it's inserted, most patients don't notice any bump from the balloon itself, but you may feel it moving about when you lie down. For days after the procedure, some people will throw up a lot. You may get some stomach pain, nausea, heartburn, especially after eating anything. You will likely have to go on an all-liquid diet for the next few days. A lot of this is because your stomach is not used to having a balloon there, and people often mistakenly overeat, causing their stomachs to overfill and throw it all back up. Most of these problems usually go away in a month or so, but everyone experiences their balloon differently. Some people don't experience much at all and are able to go back to regular eating within a few days. Serious side effects like gastric ulcers are rare, and your doctor should screen you for them. Is it effective? From my experience, most people lose around 5% of their current weight in the first few weeks without too much difficulty. So on average, a 180-pound person may drop to around 170 pounds in the first few weeks. However, this is where it gets difficult for many. Without a complete weight loss protocol, like proper dietary interventions, people often stall, relying on only the balloon, or even begin to regain weight in the following months. With the proper weight loss protocols, the balloon can be quite effective at suppressing appetite and preventing overeating. The mechanism by which it works is pretty basic. It's essentially like having the volume of your stomach reduced to 1/2 or 1/3 its size, controlling your appetite by allowing you to eat only small amounts of food at a time. Don't expect to get the balloon, do nothing else, continue to eat and live exactly the same way as you did before, because you will find that any initial weight loss you do get from the balloon will stall quickly or even reverse. Is it worth it? The cost of the entire procedure runs in the thousands, and the answer to this question is largely a personal one, based on your situation and finances. I would say that make sure you're ready to change other aspects of your life and diet, as well as use other weight loss tools or protocols to help before you commit to a balloon. For those interested, I've linked the kind of weight loss protocol I use for my patients on gastric balloons down in the description. So, there's a quick overview of what to expect. If you're interested in learning more and want me to make more in-depth videos about different weight loss procedures, let me know down in the comments below. As before, I'm Dr. Brian Yeung, bringing you reliable, up-to-date weight loss information on this channel. Subscribe if you're interested in learning more, or share it with someone you know could use the info.